where to place the stethoscope or Doppler to listen to your baby's heartbeat. If it's ROA, the approximate points the baby's head sounds are shown on the image. Posterior, left posterior, direct posterior, left anterior. Listening to baby's heart rate tells your midwife if everything sounds normal. The fetal heart rate is assessed for its presence, its rate, and its regularity. A normal heart rate is between 110 and 150 beats a minute. If it doesn't sound normal, your midwife may order monitoring or a scan to confirm her findings. A healthy heartbeat sounds like a galloping horse, not too fast and not too slow. Stress and anxiety can increase or lower your baby's heart rate. With good listening ears, your skilled midwife can tell where your placenta is lying because she will hear a whooshing sound of the placental blood flow. She will only be too happy to explain everything to you. It's great to hear baby's heartbeat. The way it beats, how fast or slow it beats, tells your midwife if everything is okay or not. But it's better you learn this before you take your own baby's heartbeat, because it will save you a lot of anxiety. Abdominal examinations are performed during labour. Abdominal examinations are done to assess how your labour is progressing and to help make decisions regarding your care during labour. There's usually no need to perform a vaginal examination in normal labour because examining your tummy tells baby's position and descent. Thank you. Okay, are we back?
So much. Thank you.
Okay, any question? Anybody want to ask me anything on this? Okay, Gail, go ahead.
I would just like to say that it was very, very clear for a woman to understand this, because I get so many times when I hear when women here in Belize go up to their midwife in the hospital that they're not told anything about the baby's lie, the baby's position, what they're even doing to her. It's just amazing to me. One lady was told that her uterus was too hard, and she came home all worried, and she called me, and I said, "What do you mean it was hard?" She says, "I don't know." She just shook her head and said her baby's hard. So I called the midwife in the hospital, and here's what happened. The lady had a contraction while she was palpating the uterus, and she just said, your uterus is hard. And then she went about her business. But the woman went home terrified, because the only verbal statement the midwife made was, your uterus is hard. So communication skills, and this, with your videos and your clear understanding of the situation, then educating the women will help them relax and reduce stress. And they'll understand it. But when a midwife unknowingly makes a ridiculous statement, she wasn't saying there was anything bad. The woman went home terrified. And she called me because she doesn't want to upset the midwife because they may get mad at her.
Yeah, and I always found that when women come to the clinic, sometimes they're either a little bit anxious, but like the body behaves like, if you think of I don't know, if you've got like a turtle and you put your fingers to its mouth, it'll just clamp down. Yeah. Well, what I usually find before you palpate is that as soon as I touch that uterus, it contracts. It's like protecting the baby. So I always tell women I have to wait a little while. So you just warm your hands and gently just place them on the top of the abdomen and tell her it's what your baby, your tummy's going to contract and then it's going to relax again. And that's the time to start feeling the baby. Now, I only learned that again, it's these observational skills, it's these connectedness skills. I see so many women walk into a clinic, the midwives, they're just going to feel your baby, you know. I'm like, well, hello, you know, how can you get a proper palpation if you don't understand how the body works, how this, you know, this woman needs to be relaxed, how you just need to gently put your healing hands on top and just wait for baby to get used to your hands and talk to the woman, because then she'll relax and then you can feel the baby much better. You know, the other thing is, like when I talk about the fluid, you know, we older midwives were taught how to check the fluid with a flick of the fingers. Has anybody done that? Yeah, so you put your hand on one side of the on the side of the uterus and just gently, and then from the other side, so like you put it where the back is, gently, like a little curve, and then you just flick across and you'll feel that ripple, like a little wave that'll hit your hand. Okay, so if you get a big wave crashing against your hand, you know she's got a lot of fluid. And the way I taught it in China was to blow a balloon up, fill it with water, and put the balloon just down there, and you flick across, and you actually feel the ripple across your hand. So it's the way of seeing if the woman's got fluid around her baby. It's the old-fashioned way of doing it. That midwives are not taught that today.
They're not taught a lot of things today, my darling.
No.
They're taught medical stuff, but you know, doctors don't know these skills. I know 90% of my OBs that are my friends do not know how to palpate a baby anymore. They just grab that ultrasound and they just do an ultrasound every single appointment. And of course, I don't like a lot of ultrasounds, right? And so they don't, but they have lost the skill, not because they're not educated or not because they're not nice people. It's because they don't know how to do it anymore, because they don't practice it.
Yes, and the 5-minute visits in the doctor's office as well doesn't help, does it? And you know, when I was in China, I did lots of clinical skills with the obstetricians and the midwives in their clinics. So we went into the obstetric clinic, you know, we took a doll and pelvis in there with us, and we had the obstetricians palpating, you know, and they were loving it, and we were getting them to get the husband or the partner to come and say, look, feel your baby, feel where your baby's in, you can do this, you can feel the descent of your own baby, you know, you don't need me to tell you where your baby's head is, you can come to the clinic and tell me where it is, because when they watch this video they know how to do it, right? So like the women,
well, yeah, we can teach a husband to do it. We can teach a husband to feel his baby and tell the position of the baby. We can even teach the woman herself by just having her put her hand. But doctors don't know how to do it.
No, they don't. And that was very evident when I went around China, because I think, you know, we never usually spend much time in an obstetrician's office or his clinic, you know, and in China, I got to see the whole thing. You know, and we actually gave them we examined them on palpating the baby, you know, they had to do an examination, a full check. So the doctors got grilled, we did a check, and you know, not one doctor washed their hands. Only the midwives washed their hands. It was like, you know, we had to teach them hand washing. I mean, I failed the obstetricians for not washing their hands. It was just like so funny, you know. Yeah. So observational skills again. That shiny tummy tells you there's fluid around the baby. The stretch marks tells you her diet's not good enough. Yeah. When a woman comes to your clinic, look at her posture. You don't want, if one arm, shoulders lower than the out, okay? So that's going to tell you that this baby ain't going to go straight into the pelvis. Maybe she needs a chiropractic adjustment, yeah, before that baby comes. So again, it's all these observational skills and that connectedness and involving the partner and teaching the woman about her body.
Yeah, yes, but you remember 300 years ago when women learned all of these skills about proper eating and herbs and good diet and palpating, they were called witches. Yeah. And they were burned at the stake.
Absolutely. Well, they call me the White Witch of the West.
We love
Oh,
this
good. Oh,
information.
good. Good. I'm glad.
Is anyone else want to raise their hands? Because I've got lots of names here. I can't see faces, but there's a little thing you can, if you want to, just raise your hand. Let us know if you want to chat. Go into the reactions at the bottom of the thing and just put a hand up if you want to speak. I think a lot of people are watching, but is everybody shy out there? Does anyone want to ask? Okay, someone's connecting.
And from them.
Yeah, somebody's connecting.
Let them
Disconnecting
introduce
audio.
themselves and from where they are, because
Is it-
tomorrow and the day after tomorrow we have our next class, and
Yes.
we have to know them. We want to ask questions in this class. Then we will provide you certificate for 3 days training. If you've been more active in the class, we will give you this certificate. Please try to be more active in this class. Thank you so much.
Yeah, you've got to remember that this platform is like, you know, when I was in China and I would have all the midwives used to sit in and they used to come in, but I used to find that obstetrics was very dominant, so the midwives wouldn't ask the obstetricians questions. Yeah, so they were all very shy. And there's also like a thing in China called losing face, so they're afraid of getting the questions wrong. So I had to build a whole trusting relationship up with all the midwives to say anything you say on this platform and any debate or any question, everything's valid, you know, because we're all here to learn from each other. So be open and ask your questions and never be afraid, because we're all here as friends and colleagues to support each other.
You to exercise and practice your self-confidence, because you have to present yourself for mothers and their family, and you have to know how to present your skills in front of your colleagues. So we want an influensive midwife. Try to practice from here. If you are a nurse, if you are a midwife, if you are a doctor, here is the best place for you to practice. Please don't hesitate to ask your question. Louise, over to you, please. Yeah, please.
Oh my. For me, one of my first questions was from when rewinding back to the customer's growth chart video. Like it was an experience. I just had a birth recently because I'm currently on placement as well. And this woman, I didn't have enough time to build a relationship. I met her actually at the birth, so that was beautiful for them to welcome me into their moment.
Yeah.
So. And I was reading the notes, and it was saying that this baby, because she wasn't induced, and the rationale for the induction was because she was potentially carrying a small for gestational baby, and the baby was measuring at the 12th centile. And so I got very curious. And then when the baby was born, it was a very normal sized baby, and the baby was healthy.
Okay, let me go through like the growth charts are great. So like if you've got a customized growth chart and she's European, for example, yeah, it's quite standard. But if you've got a customized growth chart and it says she's Indian, yeah, well, the Indian women's statures differ. If they're North Indian, they're like from Pakistan and they've got bigger frames. So often these babies will go, are above those centiles. And like I've got another lady that's from southern India who's very slim and very tiny and petite. Yeah, and her baby's showing lower than the 10th centile. Okay, so you've got to have this whole picture and understand that. So if she's coming below that, but yet she's growing in that nice thing, you know, that's okay for her. But what these growth charts do, and that's why you need to have training into how to understand them and look at the big picture, because they can lead to too many interventions. Okay,